I know guys who are working desk jobs that are, you know, working into their 70s, 80s, right? Like as long as your mind's still operating, right? You can still keep working. But surgery, not just plastic surgery, but any surgery, I assume, is a bit different, right? You need to have steady hands. Is there a shorter time period to this, or
Okay, so that's a difficult question because there are plenty of surgeons that are more than capable of working well. There's actually no law that says you have to stop as a surgeon at 65. That's the first thing. And it comes down to skill set. You've mentioned the steady hand, so that's a little bit of a myth. So you do not have to have steady hands to be a surgeon of any kind. What you have to be able to is to be able to control the hand. And there are various ways that you can position yourself, spin yourself, control yourself to actually have the steady hand. As one ages, the hand-eye coordination can change. And I think once you lose hand-eye coordination, that can be an issue with particularly fine work, but there's no law that says that you cannot. Even in the public system, there is no law that says that surgeons must retire at 65 or 70. But again, it's like leaders it's like I use it as an example. Think of what's his name, Joyce at Qantas. He was a leader that started out well but stayed on too long. Basically, he didn't know when to leave. Good surgeons know when to, I think, lay down the tools. So if your complication rate starts going up, your patient complaint rate is unacceptable or going up, then I think you need to address whether or not you're capable of continuing in that practice, is the bottom
yeah,
line.